Uh, Thank you all very much. I actually live in Nelson, but I travel to Marlborough every month to work there as part of our commitment to the community. And I'd just like to thank Linda and her commitment to our community and trying to look after us and invite us all along, and also to thank you very much for coming along today. I hate to say there is some familiar faces. I won't acknowledge them because everyone gets embarrassed when they see me. No one talks to me at dinner parties about their problems. However, if they do ask what I do and I say urology, they'll go, "Oh, that sounds really interesting. What's it like dealing with people's brains?" And I go, "Well, men's brains are in their balls, so that's the end of that one." So I'm happy to talk about anything, but a lot of people want to talk about prostate cancer or other things, whatever. Anybody got any suggestions about what they want me to talk about? I'm happy to go with things, yes.
Andy, is there anything that you can do? What sort of advice would you give somebody who, like, you've got prostate power flow, you've got the...
Okay, so basically you're asking about some of the things we can eat and things we can do. Anything else anyone wants to talk about? Talk about those?
PSA screening.
Okay, PSA screening, yep. Anything else? Strokes, okay. So a lot of my interest, I suppose, in medicine began when I was just a young man, about 6. I remember my father, he went out shooting rabbits. He used to do that. We emigrated a lot, lived in Africa, and he likes to kill things. Another joke, there's not much between a surgeon and a psychopath except their degrees. But here he brought this little rabbit home and cut it up, and it was pregnant, and I was fascinated by this. So we had an immediate anatomy and physiology lecture on the kitchen table. And I've been internally curious about things ever since, really. I was a little bit of a slow learner when I was at school. I was into drinking and sex, and that precluded my advancement through the academic profile until I worked out what to do. And then finally I got there just. And the best part about medicine, you only need to know half of it to become a doctor. Only 50%, so it's really reassuring. So the next really big change that I had was when I was just starting out in medicine, and my father was 57 and he died suddenly of a heart attack. And I don't know how many of you men have experienced your father's death. It's quite a monumental shift in life, and suddenly you're a bit adrift and there's no anchor out there. And when you're not sure why or how or when, it was a very salutary lesson to me. And I thought at that stage that I think it's quite interesting to look at men's health and why people die young, especially us men. He did smoke 60 a day and, drank like a fish and all of those things, but I'm sure you're sick of us telling you how you should live your lives, because I think the health advice that's out there now hasn't changed much in the last 20 years. People come and go about a whole lot of things, but in essence, to be healthy, which is the absence of disease, you need to sleep well, you need to eat well, you need to be of a reasonable weight, and you need to exercise. And none of that information has changed in the last 20 years. Why don't we all do it? And maybe us looking at habits is something else that we could look at, and I've got information about those things as well. And to your question about healthy diets, how much does that contribute to our health? Overall, most diseases are going to be genetic. We're going to find that out. With cancers, most diseases are genetic. What we eat and things we do probably changes 30 to 40% our chances of getting cancers. But we will get cancers because we live longer, and our genes are designed to be slightly unstable so that Darwin's theory of evolution, whether you believe it or not, comes through. So we will all get old and we will all die. And I'm not sure whether you were here because you want to live good lives or you want to live long lives. And a lot of the time that I'm spending with people nowadays is trying to say to them, how can we maximise your lives and what are the key things you want to do and enjoy? And a lot of people now with men are very anxious about their prostates, and it's become a little bit of a lightning rod. for health. And Sharon, as you know, has talked about that, and she deals with all the problems that I create. I hate to say. Should you screen for prostate cancer? Who here knows what their PSA is, the value of their PSA? So it's quite a reasonable number, isn't it? PSA is an enzyme that's made by your prostate, and it's a blood test, and it looks for the presence or absence of cancer, but it's not perfect. And a lot of people will question whether you should actually do it or not. I think you should do it if you've got a family history of prostate cancer, or you have trouble passing your urine, or concerns with that, which Sharon's been through. Whether you should do it just because you want to do it is a conversation you should have with your doctor, because it carries a lot of risks. And coming to see me is one of them. Whenever we have a James Bond theme party, all I need to do is dip my finger in gold, and I just walk around as Goldfinger, and everybody just looks at me and works out. It takes a long time to work out what's going on. But I suppose in this community, I probably feel more prostates than anybody else. And when you come and see me about prostate problems, that's what we do. We put a finger up your bottom, but it's not that bad. It's just a poo going backwards. And if you have prostate cancer, we're often talking to people about what they want to do. Not all cancers need to be treated nowadays. Some we just watch, some we treat with surgery or radiation. But the trouble with the treatments is it can make you have problems with erections, and it can make you have problems with continence, and that's where Sharon comes in. And so I spend a lot of time talking to men about leaking urine, and a lot of time talking to them about their sexual function, because as men, we still believe that intimacy equals sex. We don't actually appreciate that for our female partners. Sometimes just holding hands is really what they want, or someone to listen to them. And sex is important. I'm not trying to diminish it at all, but I think that sometimes we get confused about that process. So should you be screened for prostate cancer? I believe that you should if you have risk factors or problems passing your urine, but not necessarily if you're not prepared to go through with the whole process. You should go and see your GPs. All you need to learn from today is that GPs, you pay them, they will look after your health. If you have a problem with a change, go and see them. Depression, everyone knows about that, don't they? John Kerwin's famously talked about how depression is an illness, not a weakness. I'm one of those people that's had depression, and I still have medication for it. That's just part of who I am. I don't mind sharing that with anybody, because it's an illness, it's not a weakness. I went to my GP at 45 to have my blood pressure checked. Unfortunately, it was elevated. So now I'm on blood pressure tablets as well. But she told me I was fat too, so that's good. So the trouble is, if you start this process, you have to be committed to knowing that there is a possibility of having to have treatments. So health is a really interesting point for men. Why are we interested? Because we're here. And really, I'm happy, not to talk anymore about my little specialty, but to answer questions for people if they have anything they'd like me to explore or anything else.
Just, you mentioned PSA and of course Goldfinger.
Yeah.
What is, I'm more comfortable with PSA, which is just a blood test.
Yep.
Why should I have the other one?
20% of all prostate cancers have a normal PSA blood test. So the blood test itself isn't actually that good. So if I do a PSA on you, if I do 1,000 men, roughly 130 will have an elevated PSA. But there'll still be a number of men who have prostate cancers that you can feel, and that's why you try and combine them. So that's why. And in lots of ways, the reasons we don't get these are a whole lot of stigmas about sexuality and issues with rectums and, all of those things. I think in lots of ways we've got to get over ourselves. You know, at the end of the day, I would not remember one prostate from the next. Yet again, embarrassment's the strongest emotion we have.
So if you're, say, 60 and over, how often should you get a check like that?
It depends on your PSA, and it depends...
So you use that as a guide?
Yeah, you can do, yep. And so forth. I had one man I saw today whose PSA, normally it's below 4, his level was 2.1, yet he had significant cancer because his prostate felt firm. You probably, I would suggest if you're going to get your PSA checked, get it checked at least biannually. So every 2 years.
Why don't they send out reminders for men?
Mainly because that if you look at a screening program, you have to have proven effect that improves the lifespan of everybody who gets screened. We don't have that information for men and prostate cancer. We do for breast cancer, we do for cervical cancer. And one of the main problems with the screening is that men aren't very good at turning up to their GPs anyway. And I think that a national program would be very difficult to institute. You know, and probably part of the people we really need to touch with all the health is our Māori families here, because Māori have the worst health statistics for everything. You know, and we really need to care for each other, and we need to start caring for our young men, and we need to mentor them and show them how we're going to look after our lives. Because unless we act and we look after ourselves and go to the GP, and these young men see that that's what we do, how we care for ourselves and our families, how are they going to learn? Long answer, sorry. Yes?
Is it true that even with the finger examination you can't feel the whole prostate?
Yeah, the whole prostate, it sits below the bladder, and you can only feel part of it, the outside part. You can't feel the inside part. There's a new technology emerging using MRI scanning, which may become more useful, but it's not everywhere at the moment in terms of the machines and the expertise to read these scans. So you're perfectly right, you only feel part of the prostate, and it's not a perfect science. Far from it. Yes?
If you have, is it BPH?
Yep.
Do you have an elevated risk
of
developing?
Yeah. BPH stands for benign prostatic hyperplasia, which means as we get older, our prostates get bigger, and that's a genetic predisposition. So as we get older, we get more trouble passing our urine. BPH increases as we get older. Cancer increases when we get older. So correlation is not causation. They're linked because of age. So one doesn't cause the other.
I have one more question. Would you feel like any pain in your abdomen if you have an enlarged prostate? Like, is it pressing on other organs?
Your prostate doesn't do a whole lot. It just makes fluid that comes out in your semen. So a lot of the trouble is with prostate cancer, the only symptoms you get of that are when the cancer's spread. And that's why it's a silent killer. The trouble you have passing your urine is usually either trouble getting started with a poor flow or going to the toilet more often, which can be associated with cancer. And 1 in 3 men as we age will get these problems, like I get up at night to go to the toilet. You know, we all go, oh, that's part of getting old, isn't it? When it becomes a problem for you or you think it's abnormal, you should get it sorted out. Because there is tests to check what's going on, and there's very good treatments for those conditions. So if you've got trouble passing your urine, you don't need to have an operation in all cases, but you can get treated and your quality of life can improve dramatically. Yes?
If the prostate is such a, you often use the sort of like a benign type of gland, why, has there been any research as to why the incidence of cancer on prostate is so high versus other parts in our body? So why who picked prostate?
I think that's another really good question, and nobody really knows why the prostate has such a high incidence of cancer. It is related to the ageing process, and we're all getting older. It's also related to diet, and 30 to 40% of the time. So the diet we're eating tends to be more carcinogenic. And we all know what a good diet is, don't we? You know, low protein. How much protein should you eat? Your weight in kilos and grams a day. Not much. Fresh fruit and vegetables, healthy diet, the little pyramid. You know it. I don't need to shove it down your throats. You know, and you can't really do much else to change that risk. You can only do what you can do. Shit happens.
But it's interesting, isn't it? Because the rest of our body is exposed to the same things
Yeah.
as the prostate is.
Yeah. Well, there's no doubt that all of us have distinct susceptibilities, and it may well transpire that the prostate itself, you're born with inherent susceptibilities which get concentrated in the prostate, but we still don't understand that mechanism completely. And even if we do understand it, will we be able to correct it? I don't know. There'll be an answer in our lifetime.